Ever wondered how a tiny mineral like calcium can cause disorders that affect our lives in significant ways? Well, buckle up, because we're about to take a quick dive into the fascinating world of calcium disorders. Now, when we think of calcium, we usually picture a tall glass of milk or maybe even a healthy set of teeth. But calcium is much more than just a dietary requirement or a building block for our skeletal system. This small mineral plays a crucial role in our body, functioning as a key component in various physiological processes. From facilitating muscle contraction to assisting in blood clotting, calcium's role is extensive and vital. But what happens when there's an imbalance in our body's calcium levels? Well, that's when we encounter calcium disorders. These are conditions that arise when the calcium levels in our body are either too high or too low. And while it might seem like a minor deviation, it can have significant implications on our health. You see, calcium disorders can manifest in various forms. Some may show up as subtle symptoms that might be easily overlooked, like fatigue or muscle weakness. Others might present more severe complications like kidney stones or osteoporosis. In this video, we're going to explore different types of calcium disorders, their causes, symptoms, and potential treatments. We'll look into how these conditions can affect different organs in our body and how our lifestyle choices can influence our risk of developing these disorders. So, whether you're a health-conscious individual looking to understand more about your body, or a medical student seeking to expand your knowledge, this deep dive into calcium disorders is sure to provide valuable insights. Remember, knowledge is power. The more we understand about our bodies and the conditions that can affect them, the better equipped we are to maintain our health and well-being. Stay tuned as we delve deeper into the world of calcium disorders and their impact on our health. Imagine having too much of a good thing. That's what happens in hypercalcemia. Yes, even something as essential and beneficial as calcium can become a silent threat when it's present in excess in our blood. Hypercalcemia, as it's known, is a condition that occurs when the calcium levels in your blood are above normal. You might be wondering, how does this happen? Well, the most common cause of hypercalcemia is overactive parathyroid glands. These tiny glands are located near your thyroid and control the amount of calcium in your body. When they're overactive, they release too much parathyroid hormone, resulting in high calcium levels in your blood. Now, you might think that having a little extra calcium couldn't hurt, right? After all, it's good for your bones and teeth. Unfortunately, that's not the case. When there's too much calcium circulating freely in your bloodstream, it can lead to a variety of symptoms. These symptoms often start subtly. You might feel a little more thirsty than usual or notice that you're urinating more frequently. Over time, these symptoms can escalate to abdominal pain, bone pain, and even kidney stones. And speaking of kidneys, they bear a significant brunt of this condition. The excess calcium can cause your kidneys to work overtime, leading to kidney dysfunction or even kidney failure in severe cases. But before you start worrying, it's important to remember that hypercalcemia is not a death sentence. On the contrary, it's a condition that is completely manageable with early detection and appropriate treatment. If you're diagnosed with hypercalcemia, your healthcare provider will work with you to manage your calcium levels. This might involve medications, lifestyle changes, and in some cases, surgery. So while hypercalcemia can indeed be a silent threat, it's one that can be tamed. It's a testament to the fact that too much of a good thing can sometimes be harmful, and a reminder of the importance of balance in our bodies. Hypercalcemia might sound daunting, but with early detection and proper management, it is completely manageable. On the flip side, what if your body doesn't have enough calcium? Welcome to hypocalcemia. Now imagine a world without enough calcium. It's like a city without enough traffic police. Chaos ensues. This is what happens in the body when there is a deficiency of calcium, a condition known as hypocalcemia. So what does hypocalcemia look like? Well, the symptoms can be as subtle as a whisper or as loud as a thunderclap. On the softer side of things, you might experience muscle cramps. You know, those annoying knots that seem to pop up out of nowhere. They're not just random occurrences. They could be your body's way of ringing the alarm bell, signaling a calcium deficiency. But muscle cramps are just the tip of the iceberg. Hypocalcemia can also manifest in the form of confusion. Imagine walking into a room and forgetting why you're there, or misplacing your keys more frequently than usual. It's not just about being forgetful. It's about your brain struggling to function without enough calcium. In some cases, hypocalcemia can even lead to depression. Now that's a heavy word. But it's important to remember that mental health is just as important as physical health, and they're often intertwined. If left unchecked, hypocalcemia can progress to more serious conditions like osteoporosis. Picture a skyscraper with a weak foundation. It's bound to crumble sooner or later. Similarly, without enough calcium, your bones can become fragile and prone to fractures. But here's the good news. While hypocalcemia might sound like a big bad wolf, it's not invincible. With the right medical care and awareness, you can tackle it head on. It's all about listening to your body and seeking help when something feels off. So let's not underestimate the power of calcium. It's not just a mineral, it's a silent guardian, a watchful protector of our body. Hypocalcemia can be as tricky as hypercalcemia, but again, awareness and proper medical care make all the difference. Ever thought crystals could be harmful? In calcium pyrophosphate deposition, they are. Let's talk about this interesting yet potentially painful condition called calcium pyrophosphate deposition, or CPPD for short. CPPD is a metabolic disorder where small, sharp, calcium pyrophosphate dihydrate crystals start to accumulate in our joints. You can think of these crystals as unwanted guests who decide to set up camp in your joint spaces, creating havoc and discomfort. But what exactly does this mean for our bodies? Well, these crystals are not the friendly kind. They can cause significant joint pain, swelling, and stiffness. Often, these symptoms mimic other conditions like gout or osteoarthritis, making CPPD a bit of a medical chameleon. It's like a master of disguise, often leading even the best of doctors on a wild goose chase. Now, you might be wondering how these crystals get there in the first place. It's a good question, and the answer is, we're not entirely sure. What we do know is that it tends to occur more in the elderly, and it's not uncommon to find these crystals in individuals over the age of 60. But don't worry, younger folks aren't entirely off the hook. It can happen to them too, although it's considerably less common. The tricky part about CPPD is that it's often asymptomatic, meaning it doesn't always cause symptoms. Some people might have these crystals lounging around in their joints and not feel a thing, but when the symptoms do occur, they can be quite intense, often mistaken for a gout attack or signs of osteoarthritis. So how do we deal with these crystal invaders? Through a combination of medication to manage pain and inflammation, and physical therapy to keep the joints flexible. In severe cases, surgical intervention might be necessary to remove the crystals. CPPD might seem like a daunting condition, but with the right treatment, it doesn't have to be. Remember, knowledge is power. Understanding CPPD is the first step in managing it effectively. So, keep learning, keep exploring, and let's continue this journey together in the world of calcium disorders. Genetics can be a tricky business, especially when it comes to familial hypocalciuric hypercalcemia. Familial hypocalciuric hypercalcemia, or FHH for short, is a mouthful of a name for a genetic disorder that results in lifelong elevated levels of calcium. It's an interesting case, a bit of a paradox really. You see, despite the high levels of calcium in the blood, patients with FHH often have symptoms that are mild, or sometimes non-existent. This condition is a bit of a wolf in sheep's clothing. It hides in plain sight, masquerading as other conditions, making it a challenge to diagnose. It's often mistaken for primary hyperparathyroidism, a condition that also results in high calcium levels, but requires a very different treatment approach. FHH is a genetic disorder, passed down through families, hence the name. It's caused by mutations in certain genes, the most common being the KSR gene. This gene provides instructions for making a protein that controls the amount of calcium in the body. When this gene is faulty, well, things can go awry. Now, don't let the absence of symptoms fool you. Just because a person with FHH may not feel sick doesn't mean the condition is harmless. Prolonged high calcium levels can lead to complications like kidney stones, osteoporosis, and in rare cases, severe kidney damage. But here's the kicker. Despite these potential complications, FHH often doesn't require treatment. The key is to differentiate it from other conditions that do, and that's where the challenge lies. So what's the moral of the story? Tests, tests, and more tests. Genetic screening, blood tests, urine tests. These are the tools that can help us peek behind the curtain and catch this sneaky disorder. FHH is another example of how early detection and awareness can make a world of difference. It's a reminder that sometimes what we can't see or feel can still affect us. And it's a testament to the power of medical science and the importance of staying vigilant. When the parathyroid gland gets overzealous, we end up with primary hyperparathyroidism. Primary hyperparathyroidism. That's a mouthful, isn't it? But it's worth getting to know this term because this condition is a classic example of when too much of a good thing can be, well, not so good. You see, our parathyroid glands, these tiny powerhouses located behind the thyroid, are in charge of producing parathyroid hormone, or PTH. Now, PTH is a superstar in our bodies. It's the maestro conducting the symphony of calcium levels in our bloodstream. When it's all harmonious, PTH ensures the right amount of calcium is absorbed from our food, released from our bones, and excreted by our kidneys. But what happens when the maestro gets a little too enthusiastic? When this gland starts belting out PTH like a rock star on a world tour, we end up with primary hyperparathyroidism. And just like an overzealous rock star, it can cause quite a bit of chaos. With an overproduction of PTH, our calcium levels skyrocket. When calcium is too high, things can go haywire. Patients often experience fatigue, feeling like they've been hit by a truck. They might grapple with depression, a mental fog that seems to cloud everything. And let's not forget about kidney stones. These painful little crystals form when there's too much calcium in our urine, a common symptom of primary hyperparathyroidism. Now, I know what you're thinking. This all sounds very dramatic, and you're right, it is. But the good news is that primary hyperparathyroidism is often treatable. With the right medical intervention, we can bring that overzealous parathyroid gland back in line, restoring the harmony in our body's calcium concert. Primary hyperparathyroidism is a reminder of how interconnected our body systems truly are. So, let's keep the conversation going, to understand, to learn, and to ensure that we're all in tune. So, we've journeyed through the intricate world of calcium disorders. Let's recap. We've explored a multitude of calcium disorders, each with its unique characteristics, symptoms, and management approaches. These conditions, while varied, all share a common thread. They involve an imbalance in the levels of calcium in our bodies. First, we dove into hypercalcemia, a condition characterized by excessively high levels of calcium in the blood. It's often a silent threat, as many people with this disorder don't exhibit symptoms until their calcium levels are extremely high. Symptoms can range from mild, like fatigue and excessive thirst, to severe, such as kidney stones or cognitive difficulties. Early detection is crucial to prevent complications and improve outcomes. Then we transition to the hidden danger of hypocalcemia, where calcium levels in the blood are too low. This disorder can lead to symptoms like muscle cramps, numbness, and in severe cases, seizures. It's often caused by an underactive parathyroid gland or vitamin D deficiency. We also shone a light on calcium crystal diseases, which occur when calcium forms hard deposits in the body. These deposits can lead to painful conditions like kidney stones and calcific tendinitis. It's a crystal problem that can cause a lot of pain and discomfort if not properly managed. We then touched on familial hypocalciuric hypercalcemia, a genetic disorder that causes long-term elevation of calcium levels in the blood. It's a family affair, passed down through generations, and while it's typically benign, it can sometimes lead to complications. Lastly, we discussed hyperparathyroidism, an overactive parathyroid gland that produces too much parathyroid hormone, leading to high calcium levels. Symptoms can be subtle and often mistaken for other conditions, which underscores the importance of regular checkups. These calcium disorders, while complex, are manageable with proper medical care. Treatment strategies can range from dietary changes and medications to surgery in more severe cases. But remember, prevention is always better than cure. Regular blood tests can help detect these conditions early and enable timely intervention. Moreover, maintaining a balanced diet rich in calcium and vitamin D, regular exercise, and limiting alcohol and caffeine can go a long way in keeping your calcium levels in check. It's also important to stay hydrated and limit sodium intake, as it can increase calcium excretion through urine. In conclusion, understanding calcium disorders is crucial, not just for those living with these conditions, but for everyone. These disorders are more common than we think, and they can significantly impact our quality of life if not managed well. Remember, knowledge is power. The more we understand about these conditions, the better we can manage them and lead healthier lives.